We just got new information about roughly 30% increases in Medicare supplement rates for the G plan. We're going to talk about what this means for you, what it means for Medicare healthcare going forward, and maybe more importantly, what we can do about it. Because there are a lot of ways to save on Medigap that a lot of people with Medicare don't know about. So let's jump into all of that in today's video. Let's talk about the data point. And we watch this stuff every day to bring you information you can act on and know about so you can reduce your costs. It comes from CSG, which is fantastic. They just provide tons of data on the Medicare market, rates, costs, you name it. And there was one that came out on the G plan specifically. And it looked at what is the average annual cost for a G plan, and they look at things nationwide, for the 5 lowest price plans in the market. Because there's always plans or carriers that are super expensive. They looked at the least expensive ones, so that's good news. And what it showed that in about a year and a half, let's say from the beginning of 2024, the average cost went up from $1,400 a year to $1,800 a year. That's a 400% jump in just over a year. That's 30% increase. What's really interesting, if you look at the chart, it was relatively flat from COVID. The chart starts around 2020, COVID, and then it's relatively flat, and you'll see it really starts to catch up. But more importantly, look at the last 3 to 6 months. It just went exponential. It flew up. Now, we talked about this in some of our other videos as to what's driving it. There was a lull during COVID where people didn't get stuff done. There's a lot more utilization now for expensive stuff. Think cancer, think heart. Again, that's why you want to have Medicare Part A and B, and you definitely want to have something to fill in the holes. Medicare Supplement Advantage Plan, because what it means is the underlying cost is going through the roof. And let's talk a little bit more about what that is for Medicare itself and the tools we use to fill in the holes, and then we'll touch base on how we can offset this. All right, let's look at the bigger picture here, because this is really important. Medigap is interesting in that it's not dependent on the carrier denying claims. I mean, it's Medicare. Medicare makes the decisions on what gets approved, what comes through, basically, and that's not a private company. It's Medicare itself. The supplements, Medicare Supplement or Medigap plans, just look to Medicare and they pick up their share of it. The G plan is nice and clean because it's picking up most of the big holes except for your Part B deductible, doctor visits, lab, outpatient. And right now in 2025, it's $257. It'll go up next year, and we talked about that in another video. But what this tells us is the cost of healthcare, meaning how much healthcare and how much it's costing, is going through the roof. Because the carriers aren't passing through, it's not a profit thing, it is purely Medicare, because they're picking up 80% of the bills after deductibles, and then Medigap's picking up 20% with the G plan. So this tells us healthcare for people on Medicare is going through the roof. If the cost of Medigap plans are going up about 30%, we can kind of assume that the cost of healthcare for people with Medicare is going up about 30%, which means it's going to reflect in Advantage plans. It's going to reflect in Part B premium. And we talked about how that's going up over 10% going into 2026. So generally speaking, this is kind of tricky in terms of affording healthcare costs and paying for it, whether it's government or private carriers. In the next couple of years, if that trajectory keeps going up like that, we're going to have some hard questions to answer. Speaking of which, let's talk about your individual situation. What can we do about this, knowing that these rates and the rate increases are probably going to be coming in the next 12 months to account for this huge jump in rates? Whether you haven't been hit yet, doesn't matter. They're all dealing with the same underlying costs. So let's talk about what you can do about this now. All right, here we have some good news. The percentage of people that have a Medigap plan that are overpaying for the exact same coverage and network is extremely high based on our experience. We come across people all the time, It could be a series of things where they're on the old F plan. And if they move to the G plan, they might save hundreds of dollars. And really all they're taking on is that Part B deductible. That's a huge savings. If you're on the F plan, we have to look at the new G plans. If you're on a G plan, we have to check the other carriers, because we come across this all the time where a person is on a G plan. Maybe they bought the least expensive price plan when they turned 65, and they just never really price shopped it. That's the big one, because people love Medicare with Medigap. They can go to any Medicare doctor anywhere in the country. They refer themselves out. It kind of works like a PPO. There's a lot of flexibility. So they're like, oh, don't touch my Medigap plan. What they don't realize is that's all standardized, meaning a G plan is a G plan regardless of the carrier. The networks are identical. You can continue to see your doctors in the same way you do now if you go from one carrier with a G plan to another carrier with a G plan. We have to shop the market. We can do that for you. We just need date of birth, zip code, your current plan and rate. We'll see what's out there. If you're on the best price plan, we'll let you know. For example, we come across people all the time over 75 where the rate has a higher tier for people over 75 with one of the dominant carriers, but there's a very strong carrier who can be $100 less per month for the G plan. So those people are just overpaying. Medicare supplements aren't like Advantage and Part D. There isn't an open enrollment window. You can apply to change plans anytime during the year. And in certain states, like in California, you can do it around your birthday, and they don't even look at health underwriting. No health history questions around your birthday. So reach out to us. We'll shop the market, all the major carriers, see who's priced best. And if you're on the best price plan, we'll tell you. If not, we'll let you know, hey, here's the rating. We'll show you a quote with all the major carriers side by side. Then it's up to you. We're happy to help you out. Again, you don't have to wait till open enrollment for Medigap. There is no open enrollment. You can do it anytime during the year if we're in okay health, or around your birthday if you have health issues, going from a similar plan, G to G, or a downgrade, G to N, which brings up our third option. G to N is now starting to become more viable. For whatever reason, the G plan rate increase has gone up much quicker than the N plan. The N plan adds in copays for doctor visits outside of G, and we have a whole video comparing, but we should run quotes for all the G plans, all the N plans, and see what's priced best, and then we can help you compare those options. We have to address these rate increases that are going up, and those are 3 great ways to do it. If you stuck around this long, thank you. We appreciate it. You probably have more questions. Reach out to us. There's 0 cost for assistance. You can call, email, chat, or best yet, book a time, and we can go through your personal situation to address any questions regarding California health insurance. Because a lot of sources out there are nationwide, and California is really unique. We need to go through the specifics of your situation in your area to find the best options. We don't push. We don't try to sell anything. We answer questions. And if you look at our Google reviews, you'll see that reflected in how we deal with this. We're happy to help. Reach out to us and do us a big favor. If you could like and subscribe below, that's fantastic, so we can keep bringing this information to California.